Everybody. Today we're going to talk about health policy formulation. Our focus will be the United States, but the process is fairly similar in most democratic nations. This class will help you to discuss multiple dimensions of the policymaking process, to explore the role of ethics, evidence, and equity in public health and policymaking, and most importantly, to explain a policy issue to a lay audience. Now, as we've previously discussed, what is health policy? Health policies are authoritative decisions affecting health that are made in the legislative, executive, or judicial branches of government. In the United States, the authority to make health policy comes from the U.S. Constitution. However, all along the way in this process, many stakeholders participate and try to influence it. Now we're going to talk about the longest model of policy formulation. While it is a long model to explain, it's called the longest model after Dr. Buford Longest, who put together ideas from a number of different scholars to give us a model of the policymaking process. Now remember from our first lecture, models are a simplification of reality, and so what we're seeing here obviously does not include every piece of the policymaking process, but it includes enough that we can apply this model to just about any policy. So I'm going to walk us through it. I'll be talking a bit more on this slide than I would normally. So the policymaking process starts, let's say it's a brand new policy, with the policy formulation phase. And the policy formulation phase is this idea that there is a window of opportunity for a new policy when three things happen: when there's a problem, when there's possible solutions to that problem, and where there are favorable political circumstances, including the will of the people. Now, when these three things converge, then it becomes possible for the development and passing of legislation. Now, passing a law is not enough to make a change. Passing a law is the first step. Once legislation is enacted, it needs to be implemented. And so policy formulation, which in the initial stage is really a function of the legislative branch of government, that legislation now shifts to the executive branch of government, who is responsible for implementing the policies. That is coming up with all of the rules, the regulations, and the actual operations to make that law work on the ground. And when those things two happen, we get policy. Of course, policies are modified all the time, including through the court system. So a policy, there might be a law, it's passed, the government implements it, and people react. There will be feedback from individuals, from organizations, from interest groups who are experiencing the consequences of this policy. And that feedback may occur in the form of lobbying, may occur in the form of meetings with federal and state officials, may occur in the form of lawsuits. And so when there's policy modification, sometimes it's modified at the implementation phase with changes in rules and regulations. And sometimes we go all the way back to policy formulation and the law is sent back or nullified, and Congress has to act again if we want to see a policy change. Now, all of this happens in the context of the preferences of individuals, organizations, interest groups, policymakers, and everything that's going on outside in the culture. There's a lot to unpack. So we're going to take this model piece by piece, but just to recap, policy formulation for a new policy is going to start when there's a problem, a possible solution, and political circumstance. Those things happen, make it possible, they facilitate the passing of legislation. Legislation simply gives government permission to act. That legislation is then implemented by the executive branch of the government, and the policies are then on the ground. Once policies are experienced by the affected parties, They give feedback in various ways, including lawsuits that can result in policy modification. All right, so the initial formulation of policy usually starts with the legislative process. And the legislative process happens one of two things. We either get the establishment of new laws or amendments to existing laws. And while anybody can propose a bill or propose a law, only a member of Congress, a congressional representative or a senator, can introduce a bill to Congress, and only Congress can vote on bills to become law. So what is the very first step, even in this lawmaking? The very first step in policymaking is having an agenda. And it's a precursor to the development of legislation. And then we need to get that problem on the agenda. And that's what the policy window does that we've talked about. So a policy window opens when we have a problem, a solution, and political circumstances. So, for example, the Affordable Health Care Act of 2010, also known as Obamacare, which is a law passed by Congress and signed into law by President Obama. Why in 2010 did this happen? Our country has been trying since at least 1912 with President Teddy Roosevelt to pass meaningful national health insurance or national health care reform. There were efforts in 1912. There were efforts in 1930. There were efforts with President Truman. There were efforts in 1965. President Johnson signed into law Medicaid and Medicare, which provided national and state level insurance for portions of the population. There was a failed effort in the 1990s by the Clinton administration called the Health Security Act. From that failure, though, lots of pieces passed through as successes, notably HIPAA. However, there was no comprehensive legislation. But in 2008, we had a big problem. In 2008, there was a housing crash, there was a recession, millions of Americans lost homes, lost jobs. A lot of young Americans went home to live with their parents. This hit the middle class very hard. And the percent of Americans uninsured was 18% and rising. And this was a problem. But it was a problem affecting the middle class. So the problem of not having coverage for a certain portion of the population had been there. But the problem got much worse. It was affecting millions. And in particular, it was affecting people who were not afraid to express their opinion, who had the ability to organize to express their opinion. There was a Democratic president in office with a very, very slight majority in Congress. And there was a solution. We had a legislative solution to Americans not having access to care for a long time. So the latest formulation of that was the Affordable Care Act, which was the solution. And so the policy window opened. There was a problem. 18% of Americans uninsured and growing. There was political circumstances. This problem was affecting the middle class. There was a lot of political will to do something. We had a solution. We had a legislative package that was developed by experts over years that could work. And so that window opened. And through a long story that in itself could be an entire class, through much trial and tribulation, the Affordable Care Act was passed in 2010. So what kinds of problems set the agenda? So trends in the epidemiology of a disease will create unacceptable levels of prevalence. The costs of the problem to the government become too large to ignore. The cost to a set of some constituents becomes too large to ignore, so they seek relief from the representatives. The problem affects millions. But in order to get on the agenda, it's not enough to have a problem. You have to have a solution. So potential solutions need to exist. And one of the challenges in policy formulation is trying to figure out which of these many solutions do we want to put forward. And in order to do that, there are a whole set of rational decision-making models that will take into account costs, benefits, and probabilities. In addition to that, the preferences of the public, of powerful organizations, and of interest groups will also play a large role in which solution legislators will choose to move forward. But you also need political will. So what is it that makes the public care, that activates the public? Advocacy, public awareness, stakeholders. So a number of things can happen. A specific event becomes highlighted and there's widespread public concern. Or there may be a problem that affects a small but powerful group, either of individuals or of industry. Or sometimes a problem is related to another problem already on the agenda. What is political will? So public attitudes and opinions about the problem and solution, the preferences and political influence of groups that have an interest in the problem, and the positions and key views of the involved policymakers in the legislative and executive branches. Interest groups will play a large role by focusing the opinions of their members. There's health provider interest groups, there's health consumer interest groups. They don't always have the same goals or the same agenda. And so each of them will be lobbying and electioneering and really trying to push their agenda forward with legislators. And how do they do this? So interest groups do it with resources. Interest groups, think the American Association of Retired People, probably one of the most powerful interest groups in the United States. They have huge membership roles. They can activate their membership to call their congressional representatives, to write their congressional representatives if there's an issue. They have money. They have organizational resources. They can mobilize their members. They have the political resources. On their staff, they have people with expertise. They have people with political influences. And finally, motivational resources, having ideological conviction, status, and prestige. So interest groups will use all of these tools in an effort to both directly influence public opinion and to influence legislators. Interest group tactics include lobbying, electioneering, litigation, and shaping public opinion. And we'll talk more about this when we talk about advocacy. Now, research will play a large role in the search for solutions. It documents the existence of problems. Research can help us analyze different solutions to figure out what are the costs of each solution, what are the benefits, will this solution work? They can give policymakers data to build a model of health for the nation, and health services research plays a critical role here. Now, in policy formulation, that window opens, and then there's a public law. And that public law is that bridge to policy implementation. But only a small fraction of legislative proposals that make it onto the agenda ever make it into law. Most bills die somewhere along the way. There's a long process for a bill to become a law. Most legislative proposals take multiple years to pass. For example, in New York City, there is a law that New York City mandates paid sick leave for employees. This took 4 years to pass in New York City, which is one of the most progressive cities in the country. Very few laws make it the first time around. Now, laws will start as an agenda item. Anyone can draft a bill, and many bills are actually drafted by lobbying groups and interest groups, not by congressional offices, because congressional offices don't necessarily have the staff or the means to draft a bill. However, only a member of Congress can take that bill and introduce it to Congress and become its sponsor. Only Congress can create laws. A lot of times we'll talk about laws as part of a president's legacy. And that's because the president will have a lot of influence, can request Congress to pass a law, can have input on that law, but at the end of the day, it's Congress that votes on and passes the law. Now, it's the president's office, the executive branch, that implements it. So, what happens with laws? It begins when a law, bill, or resolution is numbered. Either House bill is HR, Senate bill is SR, and referred to a committee. The Senate and the House both have committees. There's a long process. And then, after a bill has been approved by both the House and the Senate in identical form, and this takes a while, it's sent to the president. If the president signs it, it becomes law. If, while Congress is in session, the president just ignores it, it still becomes law. However, if the president opposes the law, they can veto it right there. Or, if the president opposes the law and doesn't sign it, and Congress goes out of session before those 10 days have passed, it's called a pocket veto, the legislation dies. If the president vetoes a bill, Congress can attempt to override the veto. This requires a 2/3 roll call vote from members and takes a quorum to do it. It's not that easy to override a presidential veto. Again, a veto is the way we can override a law. Doesn't always happen. Now, I wanted to just bring us back to the policy diagram because it's easy to forget about the different pieces. So we've covered the whole first phase, policy formulation, bridging to implementation. So now what happens? There's a law. The law has to be implemented on the. Once a law has been passed, it needs to be implemented. And the implementation of policy is generally a function of the executive branch. So all of the departments and agencies of the executive branch are established and maintained to carry out the intent of public laws as enacted by the legislative branch, which is just a fancy way of saying that it's the federal agencies or the state agencies at the state level that do the work of implementing the law. The relationship between the executive and the legislative branch is really symbiotic. So, as we discussed, legislature enacts the laws, executive branch implements the laws, but the legislature has oversight ability regarding the laws. And there are congressional committees and agencies whose job it is to make sure the laws are being implemented as intended. Now, implementation has two phases, rulemaking and operation. Rulemaking is the establishment of all the formal rules and regulations necessary to fully operationalize the intent of the law. And then operation is the actual activities involved in carrying out the law. For example, in the Affordable Care Act, there's no description of how to set up the insurance exchanges. There's certainly not the forms needed to apply for insurance on the insurance exchanges. All of those things, all of those nitty-gritty details that need to happen to make the law happen in rulemaking and operation. Rulemaking and operation a little bit easier than legislation to change because they can and do change through the life of a law. Now, lots and lots of federal agencies implement health policy. These are just the main ones: the Department of Health and Human Services, the Department of Justice, the Environmental Protection Agency, the Centers for Disease Control, the Food and Drug Administration, and there are others. Public health is affected by so many different aspects of the environment and of policy, but these are the main agencies that you'll see implementing laws around public health. Now, rulemaking. So again, laws usually don't contain enough explicit language to guide their implementation. Even though the Affordable Care Act weighs in at over 2,800 pages, there's not enough details to actually make it work. So the implementing organizations are then responsible for creating and disseminating the rules and regulations to implement the law. Now, these rules and regulations have legal effect. They have the force of law that they're derived from. And they're not made arbitrarily, so they can and do change over the life of the law. Before, during the entire process that they're being made, draft law rules and regulations will be published in the Federal Register before they become finalized. And once they're finalized, they'll also published. So 3 steps in formal rulemaking for an agency. For an agency makes a rule, they will publish an advance notice of proposed rulemaking. In the Federal Register, they will actively solicit input and opinions from all of the stakeholders that will be affected by the rule, and then they will operationalize the rules. Now, interest groups target rules and regulations as much as they target laws, because remember, the laws, basically the legislation that gives the federal agencies permission to act and implement the activities. But the rules and regulations are where the details are. And a lot of times different interest groups are going to clash and lobby for their members' best interests. And policymakers can be expected to seek their maximum net political support. So it's really important, if you care about an issue, to not just watch the legislation, but to watch the rules and how they're implemented and which agencies are implementing them. Now, once the rules are promulgated, the implementation enters an operational stage. So those involved in implementation are expected to fulfill the mandates in the law by following those rules and regulations. The only challenge is, though, that the law could be a bad law. So sometimes laws are written and their goals aren't clear. And it's not possible to write coherent rules. Or sometimes individuals within the implementing agency may disagree with the law and will try to stall, alter, or subvert it. So well-written laws are going to contain clearly articulated goals and objectives. And when they don't, it's much more difficult to make rules and regulations to enforce them. Also, well-written laws, they're going to contain assumptions about how operationalization will work. If the policy does A, then B will result. So if that hypothesis is flawed, if the law is mandating actions, but those actions don't lead to the desired outcomes, it can be nearly impossible for an agency to carry out a law's intent. Implementation success requires, in addition to the law being coherent, having clear objectives, and having a correct hypothesis, the implementing agency has to be sympathetic to the policy's goals and objectives. And you might think it's obvious that they would, but remember, the great majority of employees of federal and state agencies stay through different political waves. So while the heads of agencies can and do change with new administrations, the workers, the people doing the day-to-day work, don't change and don't fluctuate just because a new head has come in. The implementing agency also has to have resources to implement the policy. They need the authority to do it. They need the money to do it. A law can get passed, and if no money is appropriated to fund that law, the agency is not going to be able to do much. They need the personnel, the information, the expertise. They need all of the resources to make the law really happen. Now, implementing agencies don't do this in a vacuum. Legislative oversight of the executive branch was mandated in the Legislative Reorganization Act of 1946. And what this did, in short, was mandate that Congress monitor the implementation of laws to ensure that the implementing agencies are adhering to the congressional intent, to improve the efficiency, effectiveness, and economy of government operations, to assess the ability of the implementing agencies to do the work, and then to investigate alleged inadequate management, waste, fraud, dishonesty, or arbitrary actions. How is this done? Well, through funding appropriations. If an agency is seen as inadequate in one year, they may see budget cuts. Each standing legislative committee has certain oversight responsibilities for the legislation within its jurisdiction. So those committees, once a law goes out of their committee and is passed and implemented, are going to follow how well that law is being implemented. And finally, there's a lot of direct contact between congressional representatives and executive branch personnel. In particular, there's two oversight agencies that assist Congress with this. One is the Congressional Budget Office, the other is the General Accounting Office. There's also a judicial role in implementation. So if a stakeholder doesn't like the way a law is being implemented, they can sue, and administrative law judges will hear their appeal. And finally, I just wanted to leave you with a very abbreviated timeline of the history of health policymaking in the United States. You have to remember that for the United States, the federal government comes a little late to the game. So prior to 1862, beyond immunizing, really variculating the federal troops against smallpox, and establishing merchant marine hospitals worldwide, there's really very little federal role in health and health policy. It's really seen as a state issue. Between 1863 and 1890, there's a big sanitation movement in the United States. There's a big concern with public health. Their scientific theories of the day essentially say that dirt and something called miasma, or bad gases and odors, are responsible for disease. So there's a push to get the feds more involved. Germ theory and genetic theory come about in late 1890s. Through 1934, we get the federal government more involved. There's a growing eugenics movement, which goes through World War II and has its own creepy history. But those two things guide a lot of federal policy. 1935, we have Social Security comes into play, the Great Depression, and then World War II. So the role of the federal government gets bigger and bigger during this time. And by 1961, we have the Great Society movement, which is essentially where the will of the people comes to the point where we believe America is a great society, and not in an egotistical way. A great society doesn't let people be sick and not get treated. A great society doesn't let people be homeless. A great society doesn't let people starve. A great society makes sure all its children are educated. So there's this idea that in the most aspirational of ways, we should be a great society. This is where civil rights is passed. This is where Medicaid and Medicare are passed. But there's really, beyond Medicaid and Medicare, there's no other federal and very little state movement towards ensuring access to health for everyone. Medicare ensures access to health care for the elderly, and a little bit later for some folks who are disabled. Medicaid ensures access to care for folks who are poor, specifically women and children, for a very long time. However, that's really expensive. So the next part of health policy from about 1969 to 1992, and really through to the present, is this desperate attempt of the federal government to contain all the costs they've just unleashed on themselves by starting Medicaid and Medicare. It doesn't really succeed. Costs continue to go up. In 1992, the Clintons proposed major health policy to ensure, under the Clinton administration, to try to give access to care to every American. That fails spectacularly. However, little pieces of it go through, because for the most part, Americans prefer incremental policy change. So the big package fails, but HIPAA goes through. CHIP, the State Children's Health Insurance Act, goes through, which ensures that children whose parents make too much for Medicaid but still don't have insurance and are poor can get health insurance. And there's all kinds of incremental changes that come through 2010. 2010, we get the Affordable Care Act, and that's pretty much what's driven health policy until this day.